So our purpose of the meeting is for us all to come together and share knowledge, ideas, and really identify the problems and find solutions. And our policy meeting update, what we talked about earlier.
I mean, I think in terms of policy that there's so much going on is that within the committees we were thinking about creating work groups to tackle specific issues.
Yeah.
Is there anything else, John, I left out?
The committees briefly, since it's an agenda item, we can take care of it right here. We've been having some consultants trying to figure out how we can work together a little bit more precisely. And we think that we talked about how the committees could work. It could be narrowly focused and it could branch out into subcommittees. And this is where we can all come together, maybe share. And these committees could range from communications committees to like focused on just street sheets. And we have some mandates from our Columbia report. We have loads of mandates that we're trying to achieve. And we have a healthcare committee right now we've developed, and that's focused on Medicare versus managed care, which we have a speaker today. And we are also looking to get more people enrolled into healthcare, especially people who are on the streets, living on the streets.
No, just that the COVID numbers are declining, and I'm sure everybody's seen in the media about the various things that the mayor is proposing in the Department of Education. But people should still, talk to the healthcare providers about masks when appropriate, and get vaccinated, and be ambassadors to get their neighbors and anybody who's not vaccinated yet to get vaccinated and boosted.
Okay, very good. Housing Works, anybody from Housing Works? I know Richard isn't here. Anybody have any updates?
Sure. So as I kind of mentioned to you a couple weeks ago, John, my department, Community Partnerships, is partnering with Youth and Prevention Services, David's department, to pilot a street outreach project. Our goal is to, really in my jurisdiction in the Midtown community, really target young gay men of color, young gay men who have sex with men, MSM and transgender people of color of any age, active drug users, LGBTQ youth, the homeless and unstably housed. Currently, I'm looking into where these demographics congregate the most and what would be the most helpful zones to start our outreach project. I know that right now we're thinking monthly or biweekly, looking at the data, seeing what's successful, and then reevaluating to make it a full project.
Mm-hmm. And how do you want us to help you? Have you?
Yeah, so we're really just looking for what the best, where the best place to begin is. I've looked into a couple different like neighborhood zones. I really think that, where our West 37th Street Clinic is on the corner of 8th and 37th is a really high traffic zone. And a lot of these demographics are congregating, especially around like the Madison Square Garden Penn Station intersection. I'd also be interested in the opportunity for like a health fair.
Okay. All right, cool. Jordan's online. Hey, Viner from Councilman's office. I'm certain he can help there too, right, Jordan?
Yeah, certainly you can get in touch with me, Chelsea, and we can see what else can be done.
Yeah, and there's lots of people on the network, but that sounds like a great idea. Thanks, Chelsea.
Yeah, thanks so much. And I'm so sorry, I don't want to take up more time, but I know that David has an advocacy event today, so I wanted to have him step in and see if he had anything to add.
David?
Thank you, Chelsea. I just want to thank everyone for this opportunity. Like Chelsea has mentioned, Housing Works would want an opportunity where we would have the opportunity to engage with the community members. So we want to see a situation where we're able to engage with this population either monthly or bi-weekly, and we'll be able to provide them with the support they need. So Chelsea and her team will be there to provide on-the-spot appointments, and the rest of the outreach team will be there to support them in whatever way we need to support them. Each time we come out, we will be coming out with different swag items, so like goodie bags for these clients, so that they can have something to hold on to, and would love the opportunity. So if there are locations around this areas where there are always needles, like needles on the floor, would love the opportunity to be able to clean those up. So at Housing Works, we do have a grant that we're able to go to specific I'm missing my words right now, but specific locations where there are projected harms as regards needles and sharp objects. We're able to go clean up sharp spaces, clean up the spaces and make it sterile.
Great.
So we would love all of this opportunity, and would love to partner with this board.
Great. Maybe at the towards the end when the community speaks, maybe they'll have some. If we have some community members, maybe they'll have some locations for you, and then we can certainly put that out. Okay, great. And Jordan, since you were just flashed up there a few seconds ago, anything from your office that you want to?
Nothing too particular. Eric's inauguration is going to be coming up this weekend. I see Dan Pitchinson is here as well, so I can plug that we are doing a mask and test giveaway with Ryan Health, free KN95 and mask giveaway. That's going to be at Penn South at 343 8th Avenue, which is on West 27th Street, their 8A community room. That's going to be starting at noon on Friday and last until supplies last. Yeah, if anyone has any questions, happy to answer, but no other major updates on our end, certainly, but happy to be here and hear what everyone else has.
Great. Make sure that you guys are putting things in chat too for any kind of links and so forth. All right, very good. Thanks, Jordan. Thanks so much. Thanks for being here. Rue.
Hey everyone, Rue here from Help NYC. It's great to see everyone. I always forget I'm right after Housing Works. But anyways, we have a bunch going on here at Help NYC. We are starting Twitter. We are starting Help NYC Conversations over a new platform that they have called Twitter Spaces. Any organization that provides direct services to New Yorkers in need are welcome to join us on that. The conversations will start actually this Friday at noon on our Twitter account, so please follow us at Help NYC. Help NYC, thanks to Laura B. Vogler Foundation, we'll start doing outreach and tabling this summer. If you would like us at your outreach event, please let us know. We also, thanks to the Laura B. Vogler Foundation, will be doing street sheets. We figure since we already maintain the data for updates through our listing partners, we're going to create a whole set of street sheets, starting with Manhattan, to build out into the communities. If you would like any input on that, or would like to have those street sheets shipped to you, please let me know. More information will be going out to our partners in the coming weeks. This is something that I think specifically is for this body, is that we have started. I've been talking about this in the past 2 meetings, but we have finally started it. We have launched the Landlords and Realtors Initiative. This initiative is to survey landlords, property managers, realtors, and anyone else who provides housing or has experience with people who have vouchers. So the city, state, vouchers, HASA, and also have experience working with SOTA, SOTA program. I will put the link to that initiative in the chat. And I think that is all for that. If you would like to have your organization's programs listed on at helpnyc.info, please shoot me an email and I will gladly shoot you over the information. Thank you.
Thank you. Betty Collette, are you there? Great, Mary, thanks.
Thank you. Sorry, when you said my name, the screen disappeared for some reason. All right, so I have 3 upcoming actions that I just wanted to, I'll drop in the chat. One is that New York Doctors Coalition is collaborating with Vocal, Met Council, Housing Justice for All, and some health worker groups to create a healthcare response to the subway safety plan. And to call out the fact that criminalizing people who are unhoused is not a response, to make us safer. And so if anyone, I'll put the link in the chat. We'd love your feedback on the letter. And if any healthcare groups here would like to sign on, we would also really appreciate that. Ryan Center Housing Works will definitely, we'd love to be in touch about that. Second, Housing Justice for All is planning a press conference outside of Montefiore for good cause eviction. So on the state level, that will likely be in the next week or 2. So any groups that would be interested in collaborating on that and having a speaker, that would be fantastic. There's definitely going to be a healthcare lens to that. And finally, for anyone who isn't already aware, there's going to be an in-person lobby day in Albany focused on good cause eviction and housing vouchers programs on the state level. So I don't have an RSVP link. If anyone here has the link and can share it, that would be great also. But I'll put my email address in the chat. So if anyone wants to stay in touch on any of these upcoming opportunities, that would be great. Thank you.
Super. Yeah, I think the response is really important. We have to speak really loud and strongly. So yeah, any and all input, I think Betty would really appreciate that. And we need to disseminate this. We know they don't have a plan where to put people that they move out of the subway system. So it's optics, and we have to push them for real solutions. So please, everybody kind of pitch in there. Thanks, Betty. And I do have those links too, and I had them in the previous announcement, but I'll make sure they're out there too. So thanks, Betty. Thanks so much. All right, let's see who else we have. Robert's going to be here next month. Sarah is a new contact for us. Are you here, Sarah? Sarah, I guess she didn't make it today. That's okay. Layla, are you around?
Hold up. Did you call Lily, John?
Lily, no, I can certainly do that. I think we missed you, right?
No, I spoke.
Okay. Helen O'Brien. Okay. Any new members that want to speak about any updates, what they're doing? Okay. All right. We can go on to our guest speaker today, and we have Claire Cohen, MD, Physicians for National Health Program.
So good morning, everybody. I've been listening on your meeting and with excitement. It sounds like you have a wonderful coalition here. I'm hoping I can inspire all of you to take this information back to all of your groups. But thank you for inviting me. And thank you, John. You're a wonderful host. I can say that. So I'm going to start my screen share. I think I started it, or did I not?
No, it's not.
There it is.
There it is.
Okay. So just to say a little bit about myself, I'm a adolescent and child psychiatrist who's been practicing in Western Pennsylvania for about 40 years. I've worked in a variety of settings, from school-based partial hospitals to community health centers to other programs all over Western Pennsylvania, because there's a great shortage of child psychiatrists, a grave shortage. I'm currently working both in a hospital in the morning, a residential treatment facility the opportunities are endless because there's such a shortage. A community-based faith run, Black run faith healthcare program and a private program too. So you can see I'm busy. On top of that, I've always been very active in my community. We have a local coalition called the Western PA Coalition for Single Payer Healthcare, in which we've been involved in a variety of activities to try to get our politicians to look at healthcare as a human right and a public good. I'm also obviously a member of Physicians for a National Health Program. And recently we in coalition with a bunch of other groups from Public Citizen to Social Security Works to the Center for Medicare Advocacy and so on, have become aware that there's this under the radar attempt to totally privatize Medicare. And we've been launching a fight to stop it. So I'll start with my talk. Which is about this fight. Okay. All right. So there's this program called Medicare Direct Contracting, this is the effort to totally privatize Medicare. And it was a program started in 2019 in the Trump administration as a way to enable third-party middlemen, mostly venture capitalists and private equity firms, to manage seniors' health care, and as a way for them to make more profit. So in order to understand what's going on, you just need a quick understanding of how traditional Medicare works. So the way traditional Medicare works, you pay, it's mostly funded by your taxes that you pay in your paycheck, and it goes into something called the Medicare Trust Fund. And that trust fund sits there. And when you go to the doctor bills that trust fund to pay for whatever service you've been given. Now, just a quick backup, and it's a little bit more complex, so we're not really talking about it today. Over the last couple of decades, this program, which is not really traditional Medicare, has come into being called Medicare Advantage. And it's kind of a soft privatization. So it kind of, people didn't really respond to it. It inserts middlemen in health insurance companies who manage your care, and they're allowed to keep up to 15% of that Medicare dollar for their own profit. So 98% goes to direct Medicare patient care under Medicare Advantage, drops to 85%, but here's what goes on to happen. So under the radar, the Center for Innovation Center, which was created by the ACA, developed the direct contracting. So the ACA created a program called the Center for Medicare and Medicaid Innovation. You can just call it the CMMI or the Innovation Center, to pilot programs. And then if they like the programs, to implement them without ever having to go to Congress. And that's unusual. Usually these departments and the government have to go to Congress for vetting and approval. But this program didn't have to. Well, so this is how it works. Here's the Secretary of HHS, Xavier Becerra at this point. Under him is the Center for Medicare Services. And then under that is the Innovation Center that was set up by the ACA. And then, okay. Now, Trump took advantage of this to put as the head of the Innovation Center this guy named Adam Bowler, who was a CEO of a private equity firm called Landmark Health. And he's the one who came up with this idea of direct contracting. However, the program didn't actually start until Trump was out of office. He was assuming he would be in office, he would win, but he lost. So the program didn't actually get started till April 21st under Biden. Biden did not stop the program. He let it go, let it run. So starting April 21st, 53 DCEs that are mostly private equity and venture capitalists. Some of them are physician-led groups who are also for profit called ACOs, but most of them are private equity and firms, started operating in 38 states and Puerto Rico. And at this point, about 300,000 to 350,000 seniors who think they're in traditional Medicare are under them. This is just one of the private equity firms. And this shows you how, shows you some information on that. So basically it's to give money to these private equity firms, to siphon off money. So how do these firms make money? First of all, they maximize revenues from the Medicare Trust Fund, potentially depleting it over time. And second of all, they minimize revenue spent on patient care. So how do they do this? One method is something called upcoding, in which they take seniors, make them look sicker than they are. And this is how they do this. Remember I talked about the middlemen? Those middlemen, the way they work is that Medicare gives them a set amount of money every year. It's divided into monthly payments. It's called capitations. Okay. But that set amount of money isn't the same for every senior. They have worked out a program where if you're sicker, you get a bigger set amount of money. Okay. If you're less sick, you get less. And this is what it looks like. So for a typical senior, Medicare gives to these middlemen, whether they're DCEs or Medicare Advantage, roughly $9,000. This is from 2018 figures, $9,000 for the year. Okay. And that's based on these codes. Okay. So by the way, if you were totally healthy and had no codes, they would only get 4,000, but this is the typical senior. They get 9,000. However, as you get sicker, you get different codes, which allow Medicare to give a higher capitation. So the highest code is $32,000 a year. So when we say they're allowed to keep profits out of that 40%, these DCEs, we're talking about 40% of 9,000 for each senior, or 40% of 32,000 for each senior. That's how they make their profit. And the DCEs are too new for us to be able to have a track record yet. But the Inspector General's office has shown that Medicare Advantage, which also does this upcoding, has defrauded the Medicare Trust Fund of $109 billion over the last 8 to 9 years doing this. So they're allowed to keep profit as overhead that they don't spend. This creates a dangerous incentive to ration and restrict seniors' care, because you want to get down to only spending 60% of that Medicare dollar on patients' care. And these are incentives that do not exist in traditional Medicare. Also, the reason, and this is one of the reasons why you want to stop it, not only because it is a dangerous incentive to ration seniors' care, but also it threatens the Medicare solvency because of this fraudulent upcoding, exhausting the fund. And also, I'm going to show you in a minute, it threatens seniors' ability, their healthcare choices, as well as their health. So I just went over all this. They are allowed to keep, they only have to spend 60% on patient care and keep 40% for whatever they want, which is mostly overhead and profit. Whereas traditional Medicare, 98% is on patient care. Only 2% is needed for overhead. And this is a pictorial example to show you that. Boom, boom, boom. As you can see, as we progress, less and less on patient care. How does it undermine choice? Well, the way patients get into these DCAs is they do not pick them. The way they get in is these venture capitalist firms entice doctors to join, like Clover Health or Village MD. If you've seen the ads, I'm sure many doctors have, they're telling you how they can help you with your coding and your paperwork, and all doctors are overextended with paperwork to make it easier. You just sit back, see your patients, and we'll take care of all the coding and we'll take care of all the billing for you. So doctors join, and then if a doctor joins a DCE, Medicare automatically, they call it aligns all that doctor's patients with that DCE. The patient gets a letter that looks like this. This is an actual letter from a DCE that doesn't make it clear to the patients what's really going on. It tells you no action is needed and that your doctor's doing something to help make your care better. But it doesn't make it clear what's really going on. And the only way, when we met with Liz Fowler back in November, to try to say, well, suppose the patient doesn't want to be in this, the only way you can get out is to change your primary care doctor, which can be a problem. So therefore it undermines your choice, because you may like your doctor and not want to change them, but you are forced to be in this DCE. The Innovation Center and CMS have plans to have all Medicare beneficiaries in this model by 2030. So this is going the direct opposite of what we who are in the single payer movement want to see happen. So how come Congress hasn't stopped it? Remember, this was a provision of the ACA that allowed CMS and CMMI, the Innovation Center, to go around Congress, to not have to contact Congress. So, however, Katie Porter, I don't know if anybody have ever heard of you, and Mark Pocan somehow got wind of this, and they're actually how we learned about this back in the summer of 2021. They got wind and sent a letter and let groups know what was going on, groups like Just Care, us, and other groups. So we then took the ball and ran with it. So in November 30th, we met with a variety of members of Congress, including Pramila Jayapal, and made them aware of this. Jayapal responded by coming up with a letter that 54 members of Congress signed, sending to HHS, demanding that they end the program. Well, they didn't. So since then, a bunch of hearings have been held. And if anyone's interested, I have recordings of those hearings around this. And as a result of one hearing with the Senate Ways and Means Committee, Elizabeth Warren has come on board for this fight. But of course, the DCE owners and investors are fighting back. So what we're asking people to do is a couple of things. One, we have an individual petition that you can go to here. By the way, Social Security Works and Public Citizens also have their petitions. And between the three of our petitions, we now have over 70,000 signatures to send to Congress asking, and to HHS. Actually, our petition is directed to HHS asking Becerra to stop the program. We also have an organizational letter, which we're sending out to organizations so the organizations can ask them to stop. And we're asking people to write letters to the editors, asking them to stop this program. So of course, we're asking everybody to sign on to the letter and to go to our site. We have a lot more information. We keep you right up to date on the fight. And that's where I just want to keep you up to date on one thing that's happened as a result. As a result of our fight, which we're excited about, I have to stop this and share to one other form. Hold on a second. If I can get it on here. Okay, so I was going to show you. I'll just tell you. As a result of our fight, we have we caused oh, here it is. Okay, can you see that? Okay, as a result of our fight, the Innovation Center and the industry got together and rebranded the name of DCEs. This just happened on Thursday. They announced they're no longer calling it the direct contracting model. They're calling it the REACH model, the ACA-O REACH model. So of course we all got together and pulled up this models to see what the difference was. And haha, there's no real difference. It's just a name change and a few more doctors to put out front, but it's still the same problems. The middlemen between seniors and their care, the private equity firms, the allowing the middlemen to keep up to 40% of our Medicare dollars for profit, the automatic enrollment of seniors without their full knowledge or consent, the requiring seniors that if they want to change out of the program to only have change primary care doctors, and then eventually ensnaring all Medicare beneficiaries. So basically that's the program. And as I said, we're fighting to stop it, and we're trying to get everybody to help, to be aware, everybody to be aware, so that we can all fight together to stop this program. We're saying instead of totally privatizing Medicare, what needs to happen is you need to expand traditional Medicare to cover all services, including dental, hearing, and vision. There's no reason why it can't. It's a policy choice. You can cover it all, and you need to start moving down the age of Medicare to cover everyone. Okay. Any questions or?
Claire, that's nicely done. Nice PowerPoint. Questions?
Hi, it's Maribel. I have a question for Claire.
Mm-hmm.
I've been watching this lawsuit that's going on in New York right now against Anthem, and wondering if you can somehow collaborate with some of these folks that are against this program, because that was part of the problems that they caught them upcoding, like you said, and they realized that they stole millions from the Medicare system, and so the retirees are suing Anthem right now. And I'm just wondering if, with all this activity that's going on with New York City and the retirees in New York, if are there any allies that you can work with to strengthen this case?
Yeah, well, I certainly will bring that back to the group that's fighting this, because we've been looking for ways to support lawsuits against some of these companies and some of this behavior. We knew that Anthem was, we saw a blurb in the press that Anthem was thinking of pulling back from being a DCE. We didn't know why, and maybe this is why. But yes, we would be interested in connecting with your fight. I certainly would be willing to connect with you and connect the staff of PNHP who are working on this, who may already be aware of somewhat of this fight.
Yeah.
And a little differently, Aetna is also suing because they're upset with the selection process. You know, they want to be the ones to defraud Medicare, I guess, but they're suing because they weren't chosen. So I'm wondering if, you know, any of that information could be used as well.
Yeah, well, it's interesting that you say that, because when we met with Liz Fowler, who's the head of CMMI, she claimed the reason why they couldn't stop this program is that they would get sued because they had made all these contractual agreements with all these private equity firms to allow them to be middlemen. So it's interesting to hear you saying that.
Claire, what's CMMI?
That's the Center for Medicare and Medicaid Innovation.
Okay.
That's that innovation center that was set up by the ACA, and that's Liz Fowler is the head of it.
Okay.
And
great.
that's the center that came up with this direct contracting program under Trump, the CEO of Landmark, who was a roommate friend of
right. What
one
you
of the
said.
Trump. Yeah.
Okay, David.
Yeah,
I'm sorry, Maribel. Were you done? All good?
Yeah.
David, go
Thank
ahead.
you.
Yeah, I have a comment and a question for Claire. Right now, there's a case before the Supreme Court, which is based partly on the ability, there are people who are objecting before the Supreme Court that EPA has too much latitude to act and make regulations without congressional approval. If the Supreme Court changes this so that EPA has to have more congressional approval, that could pave the way to many other governmental agencies needing congressional approval and limiting their latitude as well. Would that be a good thing overall? I'm not sure. And would that possibly solve part of this problem that you're talking about?
It sounds to me, just from what, I don't know a lot about that Sue, but from what you're saying, it sounds like it would be an excellent thing to help our cause. And it would fall right in line with what we need, because I think a lot of this under the table stuff, it sounds like, has been going on not only in terms of healthcare and Medicare, but it sounds like from what you're saying, it's been going on in other agencies too. And certainly, at least if we have Congress aware, and there's problems with Congress too, it can help us to better fight and help us to be more aware of what's going on with some of these underhanded type of deals.
Yeah, so this Supreme Court case bears watching and see what the outcome and the follow-up is to that.
Yeah.
Good. Alan?
Thank you, John. So I was going to bring up the case that Ms. Ruiz spoke about, which was started with the previous mayoral administration, in terms of cutting back on the benefits to city employees, the unionized city employees. And it was really between the union and the administration. And it's coming out of a group from Florida, retirees who were not involved because as a retiree, they were not represented by the unions anymore. And the case has been going through the courts. The judge has issued various charges to the administration. They've, as you pointed out, Claire, and thank you for that really remarkable presentation, how they switched from one name to the other name. The same thing sort of happened in this case, in which the judge said, well, you're not doing this, that, and the other. So they turned around and reconfigured their program. But the interesting thing, well, not interesting thing is, but for retirees who did not want to participate, you needed to opt out and pay a fee back to the administration or back to the administration of this new Medicare program, which was a Medicare and Advantage program. So you needed to pay to opt out of a program that never existed before. So this case, which is being pushed from retirees out of Florida, actually, and perhaps if I can get a hold of the contact people, I can send that to you.
Sure.
Its case is coming to court. It's coming to a head probably with this. I believe it's the next couple of weeks. The judge is supposed to rule on whether or not the city can go ahead and participate in this new program. If the judge rules in favor of this new program, they'll probably take it to the appeals court. But it's been going on for probably over the last almost year now. But it's a growing concern. The attack on Medicare has been going on for quite a while. The Trump administration just have to pick up on something that was easily accessible. But there's been an attack on Medicare for a long time. But this case in New York City could be a harbinger for a lot of things going forward in a lot of major cities that are looking to cut back on their own costs And it will affect city employees who gave up probably going into other forms of employment for the benefits that they relied upon for their retirement. And now they're being told, oh, well, sorry about that, but if you don't want these, if you don't want to remain in this new program, you've got to pay X number of dollars to not be in there. So thank you again for this really, really poignant presentation. It's really mind-boggling.
Yeah.
Yeah.
Do we have your email address in the chat?
I can give it. Well, there's the PNHP email address, and I could actually give you my email address too. Hold on a second. Okay.
And Claire, do you have this PowerPoint on like a Google Docs, or is it, can you put a link in for everybody? I've got some.
I've always had trouble doing this. So
You know what, send it to me. You've probably sent it to me already.
yeah, I sent it to you. I already
do it.
I sent it to you as an email.
Yeah.
So and you can send it to people. The PNHP, let me give you the PNHP email, because they have a whole site that's dealing with this, and they have staff that are dealing. I can also give you one of my emails.
And you don't mind me sharing your email, right?
Yeah, so the PNHP, here's the PNHP.
Great. Daniel says his mic's not working, but he makes a good point. Daniel says requiring Congress to have more oversight of executive departments could cut both ways. We know that because a lot of people are bought there. And let's see, conservative Congresses may stymie liberal or left or center presidents and their executive departments from taking action to protect rights or expand rights if more is needed.
Yeah, I think that's a good point, but I think the reason why we think it kind of is best to require Congress is that at least you can be aware. I mean, this, if Katie Porter hadn't, I don't know how she became aware. Katie Porter and Mark Pocan were the two people. Actually, I do know how they became aware. This woman named Diane Archer with Just Care made them aware, and she has a good relationship with them. She's a Medicare advocate and an investigative reporter for Medicare issues.
Mhm.
She, if they hadn't it might have been missed until too late. And I think at least if it's before Congress, it helps us to be aware more. That's what our feeling is. We might have been alerted more. So, but you're right. It can be a double-edged sword. But I think we definitely don't want things going under the radar. At least we can be aware and fight them.
Yeah. And Betty also mentions that she's also on the board of physicians for a national healthcare program, and that they've got an action on May 3rd, upcoming storytelling for advocacy training, and she's put her email in there, and she's asked you if you want to join our healthcare professional lobby day. And that's on May 3rd. So we have some actions there.
Yeah. So I hope that I put the email for PNHP's site on DCE's in there. I don't know. I don't think it's a smart email though. So people probably just have to copy it. You can reach me. I'm going to give you an email. You can reach me at be aware though that this email
gets inundated.
It may take me a while to answer it because I get hundreds of emails a day. Yeah. So be patient. Sometimes it helps if you send it a couple of times.
Now, Claire, you mentioned the typical coding 9,000. Sorry about that. You mentioned, I thought I had that off. I'm sorry. Um, You mentioned 9,000 uh, for the typical coding for one person, depending on their health standards. Okay, we know the healthcare is just out of whack and the cost and everything.
Mhm.
Is that even short to take care of someone?
So those figures came from 2018, 2019. I don't actually know what the figures are now, but so the way it works with the coding is for each code. So what CMI has worked out with the Innovation Center has worked out with these middlemen is that they get capitation, but the original capitation was not giving them very much profit. This was back when Medicare Advantage was first. So they agreed that they needed to modify the coding so that it wasn't just one blanket capitation for everybody, but it took into account how sick people were. So they came up with a system by which different codes add more money to that capitation. So that figure is a figure that at one time, and as I said, I don't know if that's still the exact amount of capitation at this point, that for an average healthy senior, that's called a healthy senior. Okay. However, as you have more illnesses and more problems and more complexities to your medical care, that the codes go up and the amount of money that the equity gets. And what they've been very good at is not staying at that average amount, getting it up to that higher amount. Okay. And I don't know if 32,000 is the highest amount. I be honest with you, I don't know that, but
Average, maybe?
pardon me?
Average?
That 32,000, I'm not sure if it's the average at this point. But what the Inspector General's office has been able to document for Medicare Advantage, and the only reason why they haven't been able to document it for the DCE program yet is because it's too new. It just started actually being implemented in April of 2021. But Medicare Advantage has been going on at least since 2003, actually before that under another name. And so they've been able to document that what they do is they do this upcoding, and it's not always easy to get because these guys claim proprietary things and make it hard to get the info. But from what they've been able to get, that a lot of times they're saying people, you go to the doctor and you think you're just going to get treated for your stable hypertension. You don't know that you're being upcoded to have malignant hypertension. And so, but they've been able to document that that at least the top 20 Medicare Advantage companies have been really doing some fraudulent upcoding so that they can get more money, a higher amount of capitation from the Medicare Trust Fund. And it works for them because they've been making the biggest of these Medicare Advantage companies have been making a real killing, real profit. And that is what attracted these private equity and venture capitalists. They noticed that and they said, wow, look at the money they're making. We've read some industry jobs. That's literally what they said. Look at the money we're making. Well, look, we could make that money too. And we could
They're
get
like piranhas smelling blood in water.
Yes.
Yeah, it's horrible.
And yes.
They
And
don't do anything without profit.
And of course, when Trump was in office, they convinced them, they said, let's bring that medical loss ratio from 85 down to 60% in terms of what we have to pay for patients. And of course, under the Trump administration, they were all too willing to bring it down to only 60% for patient care. So because we really want to make sure we make that profit.
Yeah, we sacrifice people for margins and then that's what we have going. And We have Maria Ortiz. I'm sorry, Maria, you're supposed to, by the way, we know another Maria Ortiz that works on Committee Board 4. And every time I see that name. Anyway, Maria, you were supposed to speak for Sarah too, but we'll get to you at the end of the meeting for that. But Maria, you have a question here? Maria? Are your mic not working? You have your hand raised, it says down here. Okay, maybe she'll get back to us. Anybody else have any questions? We're running out of time here. As much as I'd love to keep talking about this, we have a couple other things we got to get to too. Anybody else questions? Maria? I think she's having trouble connecting. Okay, anybody else? Okay, to wrap this up, you've put some actions already down on your PowerPoint. Besides communicating and getting the word out, what else can we do? Anybody? And Claire, do you have any thoughts?
Yeah. So one is to go to our website and you'll see the organizational letter and encourage as many organizations as possible. We have about 200 organizations. You don't have to be an organization focused on healthcare to sign up for sign the letter asking HHS Secretary Becerra to stop this program. And you can put in there, stop the now called REACH program. The other is we're trying to set up a program called the Medicare Protectors, in which we're trying to get Congress people to sign on. So be on the outlook for that, because then you can lobby your congressman to be a Medicare protector. Medicare protectors would strongly advocate to stop the privatization of Medicare and strongly advocate to expand Medicare by adding all services, including eye, hearing, and dental, and lowering the age of eligibility for Medicare. So we're still in the process of working on that one, but be on the, keep looking at our website.
Okay.
Keep looking at our website for that. And then last but not least, make sure you sign our petition or Social Security Works petition. You can just go to the Stop DCEs there and get our petition. Or if it's easier for you, Public Citizens petition, but sign one of those petitions out there to stop DCEs. All of them are going to Health and Human Services Secretary Becerra.
Great. Maribel, are you still on?
Hi, yes.
Yes, Maribel's pushing our health committee, by the way. I think we've got loads of information here, loads of ways we can connect. I think we have enough to move forward with a plan, an action plan, don't you?
I agree. I mean, Claire's presentation was outstanding. Really appreciate that.
Yeah. So, our health committee is focused right now on Medicare versus managed care. And this affects, am I correct, Claire? This affects Medicaid or will?
Well, so Medicaid is they're already pretty much privatized. I guess potentially from what I've seen what we've seen from some articles in JAMA and in Health Affairs, if it could potentially affect everything from Medicaid to even to the veterans to health to
they won't stop.
CHIP. Yeah, they would like to be able to enter all of healthcare, these private equity firms. So it could potentially, if they're successful, but right now, the immediate threat is to Medicare. Of course, if we had single payer, we wouldn't need any of, we just would have one thing and we wouldn't need any of these services. But
Yeah.
yes, it has the potential to affect everything if they feel that they're successful with their attack on Medicare.
Yeah, to wrap this up, I think our health committee, for our health committee, and Maribel, you can correct me if I'm wrong, but I think the idea is to include the thought of where this might go, but also when we can advocate for single payer, but our focus can still be on Medicare versus managed care. And that's where the focus of the committee is now, and that doesn't have to dissipate or anything, but in the end, we can certainly support you on the single payer, and I certainly believe in that. Does that make sense, Maribel?
Yes, and I think we would benefit from another conversation with Claire, with the smaller group, if Claire would be open to that.
Sure, I would be.
Oh, wonderful. Okay. All right. I'd love to talk about this more often, further, but unless we have some pressing questions here, and I don't see any hand raised. We have to move on because Sharon beat me up for going over a half an hour last time. So anyway, let me get back to the agenda. Thank you, Claire, so much.
Thank you.
That was brilliant. It was brilliant.
Thank you. I'm going to leave now. So thank you all.
Okay. Ted, we talked briefly, quickly. There's nothing, any new news, right? Adaptive reuse.
In terms of hotels to housing,
Yeah.
we are all waiting. The governor and I think I reported this last time, the governor reintroduced regulatory relief to facilitate hotel to housing, permanent housing conversions in her budget. And that budget has to be passed by April 1st. Although late budgets have been heard, but it's expected to it's expected to pass by April 1st. And, we'll see whether or not that regulatory relief is in there. If it is, that will help facilitate some hotel conversions. There may be some more money for the Housing Our Neighbors with Dignity Act, which was passed last year to provide funding for hotel conversions. None of that money has been used yet. That was passed last year, the $100 million, but the legislature may add more money for that. I know that there are a number of hotels on the market, but it's difficult to convert them into housing, and because of the lack of regulatory relief and the expense of it. But it may still happen. We'll see. California has converted 93 hotels, and they have 6,000 units now that they're working on converting for permanent housing for homeless people, because they grabbed the bull by the horns last year and acted. We're still talking about it here in New York.
Yep, talking. Okay. Yep. Great, Ted. Super. Might be an opportunity for one of the hotels to convert into a respite hospital. So we're going to talk more about that. Maybe have some new news.
Yeah, I would be very interested in that, because the thing is, hotels can be converted overnight into transitional settings like shelters or respite centers. And so the regulatory relief is not as necessary. And so if there's people that have, if the discussion on respite beds has progressed, I'd be very interested in hearing it. I've got a hotel owner with a hotel in the area that would be very interested in repurposing it. So.
Okay, great. Thanks, Ted. Thanks so much. All right. So let's see. I know we're running out of time. Real quick, the rally. Still working on it. Still getting buy-ins. We've gotten some buy-ins with a lot of groups. I want to get everybody on the ground level to develop this. It's I think we need people out there in the streets. Everybody agrees. We'll have more information on that. If you'd like to be a part of planning group, let me know. Basically, we have 4 points of the rally that we're looking at. We're looking at the Midtown. Each point tells a story, and overall, and together they tell a huge story. And it's pretty much the same story that you heard today with the managed care and Medicare. You know, basically a developer wants to. We don't have the housing we need to support people, and we want to build commercial buildings over, and there's another one going up, you know, at 57th Street. I just got notice that they're starting to demolish the building and starting to do the building. And basically we're building commercial over residential. We're the market's tight. Nobody's able to get housing. We're in trouble. So anyway, if you're interested, let me know. The Empire Station, Layla, are you around? I wanted to have Layla give some updates. She's not here. Let's see. We're going to skip some of this other agenda items. We talked about the committees. We're going to go right to the community concerns and any community issues, any community concerns, public concerns, any updates. Serafina, are you on?
Yep, I'm here. Hi,
Oh,
how's it
super.
going?
Nice to, did we ever, the couple, the 30-year-old couple, years or younger, Charisma brought up, did we ever, anything come of that?
I think Charisma and I lost touch about that. I think she was trying to get some more information to provide to me. And I think I was just waiting on that from her. But happy to see where they are.
I'm sorry, happy to what?
Just return to that and see where they're at.
Okay, I'll prod her. Anything you want to talk about while you're on?
No, not at this time, but I can leave my email in the thread. If anybody has any homeless concerns in Manhattan that they want to bring to my attention or just hide. So thanks so much.
Thank you. Thanks for being here. Oh, Marnie's got her hand raised. Marnie, go ahead.
Sure. Hi, everybody. Well, I just wanted to say that I had talked to a group of homeless advocates, some from the Harmonia Hotel, and they were talking about coming up with a plan themselves, you know, because they themselves are like, you know, the affected people that know best about their situation. But Ted, I wanted to ask you in terms of Hochul's plan. I know Eric Adams wants to, build more supportive housing for the homeless, but out in the outer boroughs. And I know there was an issue because, it takes a lot of, people away from their services, which are in the city. And also, like, if somebody is having like a heart attack, like if you're out in the Bronx, an ambulance, in Manhattan, or if you have your doctor in Manhattan, an ambulance cannot go, will not go to the Bronx and bring you to your doctor. So, I mean, that was an issue. So I just wanted to know, like, what is being, what is being talked about in terms of having, hotel conversions or any supportive housing being built, but in the city, so it's close to people's services. That was a really huge concern. And then the second thing I just wanted to say is we are actually, I didn't know this, but apparently one of my friends who works in healthcare, we were trying to get a NYCHA tenant a hospital bed because she's disabled. If an insurance company is not giving you what a doctor prescribed, you can actually lodge a complaint with the city's Department of Financial Services, and the complaint form is online. And an insurance company will be slapped with a $15,000 fine. So we actually did that. And after months and months of trying to call Visiting Nurses Choice, we threatened them with that, and they instantly called. And now my this disabled senior is going to get her hospital bed, like, really quickly. So I just want those two concerns I just wanted to do. But I wanted to have Ted talk about, any sort of like supportive housing being built in the city for the homeless.
Yeah, I don't have insight into everything that's going on in the Adams campaign, so I can't really speak for them or anything. I think that there are a lot of advocates that are concerned that the governor and the mayor's plan is mostly about enforcement and not enough about having, appropriate emergency transitional housing like safe havens, rather than congregate shelters, and enough permanent supportive housing for people that have, mental health issues and things like that. So we'll see. I mean, I'm choosing to give them a chance, and I hope that they come up with this. They have many of us talking as they were creating the plan, encourage them to make sure that they increase the amount of safe haven beds that would be immediately available to people, so they would be able to not just kick people off the subways, but actually get them an appropriate place for them to stay. And at the announcement, HRA said that they would have 500 new safe haven beds, which is a significant start. We should keep an eye on that and make sure that that happens and that those are available. And they also talked about expanding supportive housing, which is a more complicated thing because it takes time to build supportive housing. I think the state is making available new scattered site supportive housing, which is, issuing contracts to nonprofits who can go out and rent apartments to provide supportive housing services to people with psychiatric issues and everything. There are some concerns that it's very difficult to find anything to rent these days, even with a voucher and everything. But, once again, let's give them a chance and see what they can do. And hopefully they'll be able to prioritize people that are living on the subways and in the streets for this type of housing, because, housing is the answer. In terms of hotel to housing conversions, during the campaign, the mayor was very specific about doing outer borough hotels. And I think that, he was, certainly sensitive to the concerns of the Hotel Trades Council, which represents hotel workers. And most unionized hotels are in Manhattan or by the airports. And so I think that, there is a preference among many of us to convert non-union hotels into housing rather than union hotels, because we want to keep those good jobs. We want to keep tourism coming into New York. But most of the hotels are in Manhattan. And so I hope that, when the opportunities present themselves, that we'll be able to judiciously decide, project by project, what makes sense. I mean, some hotels in Manhattan would be very good candidates for conversion to housing. Some unionized hotels may no longer be viable in the new realities of the economy these days. And I'm hoping that, we'll be able to make those judgments in a reasonable way, and we'll come up with something. But, it remains to be seen. But I'm giving this mayor and this governor a chance. I appreciate that they're trying to do something. They're recognizing there's a problem. The governor is increasing Medicaid rates for psychiatric beds, which is a good thing. More outreach teams can be helpful, but I really want to make sure that they have more to offer people on the streets. And 500 safe haven beds is a very good start. So we'll see.
Thanks, Ted. That's great. I know this is a question for BRC, but do anyone have any numbers on how many people on an average night that are staying in the subway system? Anyone? Okay. That's probably a BRC question. I don't see any BRC people here.
Hey, John.
Yes.
This is Serafina. So BRC does the hope count as well. It's the point in time count.
Mhm.
So We just did this past year, so I don't think those numbers would be out yet, but last year's, so 2021's numbers might be a good one to reference for trains.
Okay,
And and the numbers of the subway, that were in the subway.
great. Do you know roughly offhand?
I don't know their numbers. I'm sorry.
Great. Okay, thanks. All right. Any other public concerns? Anything there? Anybody I haven't missed? I know, yes, no? Maria, are you able to connect? I know you were trying to. No? Okay. All right, let's start to close this thing. Just a quick updates. Urban Garden, we're going to do some work today to prep it. We're going to plant some things that are plantable. We're going to start to open that up April. The street sheets, the community court's going to work with us because the community courts wants to get involved, going to help with distribution. I'm sorry, somebody, is that some way? I don't know what's going on there.
It's a bomber tab 9G.
I'm sorry. Let me just check, see who's not muted. Someone's, if you're not speaking, please mute yourself.
Tab 9G. Tab 9G.
Yeah. Okay, I think I just muted them. Okay, the community court, the Midtown Community Court they're going to partner with us on the street sheets, basically. And we're going to have wider distribution, maybe help printing. It might take a little load off our budget. And let's see, what else do we have here? Anybody have anything to say? Any new attendees? Okay. Next month, we're going to be talking about the 421A tax credit. It's very important when it concerns to trying to build affordable housing. Their terms, the term affordable housing gets very misconstrued. I think we all realize that. And so I'm looking for a meeting in the evening with our consultant. I guess it's telling us to go. Let me just check to see where that noise is coming from. Yeah, we got, okay, got him muted again. Okay. Our consultant that we've been working with lives in California. He's been we've been looking at where we kind of intersect with other nonprofits to build a stronger outreach and to be more effective. So he's only available in the evening. So we're going to do a special meeting on maybe managing and empowering other nonprofits and us working together to be more effective. Anyway, that's it. I think we should probably close the meeting. It's at 10:50. If anybody wants to have any last words, go ahead. Oh, Maria Ortez, you got your hand raised. Okay, you can unmute. Go ahead and unmute. We've been trying to get you on. Maria, go ahead and unmute. Here, let me ask you to unmute. Maybe that'll help. Okay, can you unmute? Yeah, right down on the bottom, it should be where you can unmute. Bottom left hand. I can't do it for you. I can ask to unmute you, but Maria? Okay. All right. We can't seem to get her in to Maria, I'm sorry, we're not hearing you.
Hello?
There we go.
Ah, perfect. Excuse me, this is on my friend meeting with you. Okay, that I want to say is that the parent to improve school transportation committee team on people and family he have a march to over the Brooklyn Bridge for say on time school bus road for all students who need them with and without disability. We want the city to reverse the or let's say the driver shortage with COVID money, so that anybody has to drive a double road or to leave children behind. We invited you to the rally with us on Saturday 19/22 at 1 p.m. on the Brooklyn side. And continue to the pedestrian walk toward to City Hall. We expect to have permit for Calman Plaza Park, lawn, not lounge for the rally. Children and percussion instruments are welcome. This is a rally for the children that use the buses, the transportation buses. And we had some problems. The number one thing that prevents children in temporary housing from attending school on time every day is problem with the transportation. It takes more than 3 weeks to get a school bus road. For that time, the parent has to miss work to travel with the child to school and back. This is the reason that we had this rally for fighting for advocating for the children that use the school transportation.
Okay, cool. Okay, Maria, you're talking about this. Let me just recap real quick, see if I'm correct. You're talking about this little flyer that's up now. You're basically marching over to the Brooklyn Bridge.
Yeah.
Saturday, March 19th at 1 p.m. And you're going to march to City Hall at 2 p.m., right?
Yeah.
And this is your coalition here. You're connected with this coalition here, right?
Yeah.
Okay, perfect.
I
Perfect.
work with Sara Cantalicio.
I'm sorry?
I work with Cara Santalicio. Sara.
Sarah.
Cantalicio.
Okay, got it. And all this is also in the addendum E, parents to improve transportation. And, we're not getting the kids we're not getting the education they need, and we're not getting them to schools. It all kind of ties in together, right?
Yeah.
Okay, thanks, Maria. Thanks so much for being here, okay?
Okay, thank you.
All right, and thanks for everyone else for being here and for hanging on. I know I just went to 11 o'clock again, and I apologize for that, but we have so much to talk about and so much to relay, and we could do this all day, I'm sure. Anyway, thank you so much, and thanks everyone for being here. And we look forward to having you next month, and we look forward to you having you engaged.